This is a video abstract for the European Public Health Conference between 1st and November 2017 in Stockholm. The title is Improving the Quality and Impact of Public Health Tweeting in Scotland, #ScottPublicHealth. My name is Graham Mackenzie. I'm a public health doctor in NHS Lothian, Scotland. So why should public health professionals bother with social media? Well, I would argue that there are three main purposes. The first is learning and CPD. The second, networking and connecting with others. And the third is broadcasting and sharing your work and the work of others with a wider audience. The purpose of this study was to connect people across Scotland better using Twitter. There was an observation at the November 2015 conference in Peebles, in the borders of Scotland, that colleagues from across Scotland working in the same topic area perhaps didn't know each other. They weren't connecting because there weren't regular meetings around a particular topic, for example. Scotland is a small country by population, with a population of 5.3 million, but a large country in terms of its geography, spread out across highlands and islands and urban and rural areas. Now, initial attempts at connecting via Twitter alone had little impact during January 2016. People were confused by Twitter. They didn't know how to use it particularly effectively. So we set out to run a series of webinars and educational events on social media that would help people to learn and share ideas both about public health but also the use of social media. So they'd be learning about how to tweet more effectively. And crucially, I also wanted to study the impact, so I set about learning how you could measure impact on social media. The activities focused around Scott Public Health as a hashtag. So how do we assess the quality of tweets? Well, we can do it visually. We can look at a tweet and we can say, well, does it have the ingredients that will increase sharing? Does it mention another Twitter user, in this case, Cycling Surgeon, who tweets very effectively on physical activity and has a wide following? If he sees this tweet, which was about one of his tutorials, then he might retweet it to his followers. Using a hashtag allows other people to search for your tweet. In this case, if people were interested in Scott Public Health and search for that, they would find it through that hashtag. It needs to include a web link as well. This tweet's web link takes you to a massive open online course around physical activity, which is what Chris Oliver, the cycling surgeon, was talking about during this webinar. But a URL might also take you to a study paper, a research paper, and it might take you to a blog or a video, for example. And then you can assess the credibility of the information that you're reading, and that might increase the chance of you sharing it. So here we are looking at the quality of tweets for 5 periods. I've looked at 3 tweets per user for each of the periods, so that no single user will dominate. If you look at 2014, the far left of this graph, you can see that the percentage of tweets with an image, a URL or a mention is pretty low. About a quarter of tweets include an image. About 30% include a URL or a mention. By the end of the study period, these figures had increased for the non-conference tweeting, so the general tweeting using the Scott Public Health hashtag. 51% of tweets included an image, 2/3 included a URL, just over half included a mention of another Twitter user. So there appears to have been an impact on the general tweeting through this Scott Public Health hashtag. But over the conference periods, you can see that the quality of tweets is improving in some measures, but it's still pretty low. The percentage of tweets with an image has increased from 16% to just under 1/3. The percentage of tweets with a URL has gone from 3% to 12%. A minority of tweets. And the percentage of tweets with a mention of another Twitter user has remained roughly the same. Now, conference tweeters are often people who only take out their phone to tweet during a conference when prompted, whereas the people tweeting using the Scott Public Health hashtag with the conference period were tweeters who were knowledgeable, confident, able to construct a tweet with good content. The impact of tweets, well, we can measure that using a percentage of tweets that are retweeted. If somebody sees a tweet and retweets it, then we know that it's had an impact on them in some way. It might be a controversial topic, it might be a topic that interests them, but they've shared it with other people. And you can see that the percentage of tweets that were shared in this way increased over the 2014 to 2016 period. On the right-hand side of this graph, you can see a social network analysis map using Node Excel. And this shows the connections during the Scottish Public Health Conference in October 2016. It shows wide connections, it shows deep connections, and it's something that you can start to measure. So the Scot Public Health movement had achieved hundreds and thousands of connections. But I'm keen that we look beyond Scot Public Health. If we kept tweeting to ourselves in Scotland, then we wouldn't be networking, we wouldn't be broadcasting as widely as we could. So the focus has shifted away from Scot Public Health over 2017. We've used the techniques learnt during 2016 and applied it to other contexts. Top left here, we can see a Scottish Public Health conference at the Royal College of Physicians, and you can see the wide connections here, much wider than equivalent seminars in the series run by the Royal College. On the right-hand side, you can see geographical spread of tweets about the Healthy Lives, Fairer Futures advocacy campaign, reaching across to Australia, to North America, across Europe and into India. On the bottom left, you can see an example of how we've used some of the techniques learnt during this period to look at social networking, and that was included as part of a story on the front cover of the British Medical Journal. And on the bottom right, you can see a picture of the Hundertwasser House in Vienna, and this is showing us that we can use the techniques of social network analysis to extract a lot of tweets and to do a summary, for example, in this context of a European Public Health Conference last year. To conclude, we have executed, studied and published a national approach to improving quality and impact of public health tweeting. General public health tweeting in Scotland has improved, both in quality and impact, but conference tweeting remains an area for improvement. There are wider benefits to understanding how Twitter works. So in addition to networking, learning and broadcasting, I would add that analysing impact is an important public health function on Twitter. You can access the study at the Journal of Public Health using the link here, and please follow the blog if you're interested in this topic. Many thanks.